Thank you, everyone, for joining us, and welcome. We're going to get started now. My name is Alethea Caridi, and I will be your host for today's event, Effects of Pharmaceutical Waste on Human and Planetary Health. We have three experts that will explain why it is so important for all of our students, especially our health profession students, to understand the damage to our health and our environment when pharmaceutical waste isn't disposed of properly, and what we can do to make sure that it is. I'm the Associate Director of Sustainability at UNE, and I'm also the co-chair of the UNE Planetary Health Council and one of the groups that's bringing you today's event. Our event is brought to you through a partnership between the Planetary Health Council and the Center to Advance Interprofessional Education and Practice, with support from UNE Communications. This event will address interprofessional competencies of communication and values and ethics, and can be applied toward UNE students' interprofessional honors distinction. Please note that there is an attendance link that will be shared at the end of the presentation, and we encourage you to participate in that survey because we take the feedback very seriously, and we do modify our programs based on that feedback. Since 2017, UNE has been an institutional member of the International Planetary Health Alliance, which is now based at Johns Hopkins University. We have more than 380 organizations and universities within the Planetary Health Alliance and other institutions that span 64 countries. At UNE, our Planetary Health Council is working to strengthen connections between our robust environmental sciences and the health professions programs, and to provide planetary health content through academics, research, and events just like this one. Today's agenda is basically we're going to start the program with, I'll briefly introduce our speakers, and then I'm going to turn it over to the first panelists. We will pause the presentations briefly in the middle to move into breakout rooms for about 10 minutes for some audience engagement. I encourage you to turn on your cameras during the breakout and introduce yourself. We will have facilitators in each one of the breakout rooms, and they will introduce themselves and kick it off. We'll then resume presentations and provide some time at the end for questions and some discussion from you, and we will want to hear your thoughts. So our first panelist is Ronnie Souza from UNE's Department of Environmental Health and Safety. And our second panelist is Dr. Kin Lee, Associate Clinical Professor from the Department of Biological Sciences and UNE's College of Osteopathic Medicine. And then our third panelist is Jed Nitzberg, and he is the Diversion Group Supervisor from the Drug Enforcement Administration in the Portland, Maine resident office. Our breakout sessions will be moderated by our presenters, as well as some faculty and student volunteers. Their names are in the chat, and I just want to say thank you to them in advance for their help in making this event a lively and interactive discussion. And many thanks to our panelists. We're so grateful for your time with us here today. And I'm going to turn it over to Ronnie Souza, our first panelist.
Am I unmuted? There we go. Thank you, Alethea. So what we're going to cover, my section, we're going to talk about the federal and state regulations that basically regulate all chemicals, and then how the pharmaceuticals fall into those categories. And for the sake of this discussion presentation, we're going to talk about three regulations. The first of which, through the Food and Drug Administration, they set forth the rules for the delivery, collection, and destruction of damaged, expired, returned, recalled, unused, or otherwise any other unwanted controlled substances. So that kind of sets the ground rules there. When it comes to the environment, we have the EPA under the Resource Conservation and Recovery Act, and they set the rules that protect human health and the environment. And this regulation is very important when we're looking at pharmaceuticals, because this is where we find the definitions for the types of hazardous waste, and it places all of those approximately 30 pharmaceuticals into those categories that makes them hazardous waste. And then finally, we won't touch on it too much at all, but the Department of Transportation, they have a whole set of rules and regulations on the transportation of hazardous waste, hazardous material, and it covers land, sea, and air. So the pharmaceuticals would fall under those regulations if they were hazardous waste. Also, when you look at your state regulations, Maine has regulations in place that mirror all of these that I just mentioned, and most states also have the same regulations at the state level. In some situations, there could be more of a tighter restriction on certain things, but it's very specific in those situations. Next slide, please. So let's take a look at the EPA regulations and how those impact the pharmaceuticals. As I said, there are about 30 pharmaceuticals that fall under one of these waste categories. We have P listed, which cover acutely toxic chemicals, U listed for toxic chemicals, and then D listed chemicals, where we look at specific characteristics, whether something might be ignitable or corrosive or toxic or reactive. And then the last two categories don't impact pharmaceuticals all that much at the user level. You're looking at F-listed chemicals, which come from common manufacturing and industrial processes, and then the K-lists that come from specific industries. So in this next slide, I'm just trying to give you an idea of what kind of pharmaceuticals fall under the different categories. So I've got a small sample of some pharmaceuticals that fall under P listed, which makes them acutely toxic. You'll see some in there that are familiar, things like epinephrine, nicotine, warfarin, for example. From a hazardous waste perspective, it's important to remember that any of the containers that these pharmaceuticals come in, they are not considered empty under the EPA RCRA regulations unless they are triple rinsed. So, and then that rinsed product needs to be collected and managed as hazardous waste. And one that you can't rinse, but a nicotine patch or the container that a nicotine patch comes in, hospitals and pharmacies will usually collect those in the hazardous waste container. There's enough residue or unused drug in there, so it would have to be managed that way. This next slide is showing you some examples of U-listed pharmaceutical waste. In these instances where the pharmaceutical waste is exhibiting the characteristics of the D listed, they would also follow into this. So again, we're talking about corrosive, ignitability, toxicity, reactivity. Other things along with these waste streams to think about, any of the items that were used. So if you have partially used medications or unused medications, if it remains in the syringe or in a vial or a bottle, in the IV bag for medicines like chemo medicines, any loose pills or tablets, capsules, aerosol inhalers, there's creams and ointments and even shampoos, and patient prep alcohol and iodine. These would all have to be managed as hazardous waste. I already talked about the empty containers for P listed, and with D and U listed, they just have to be empty by normal means. They don't have to be triple rinsed, but still, if they're not empty, they have to be managed as hazardous waste. And then chemotherapy drugs, if they're unused or partially, those would have to be managed as hazardous waste. I think that's it for me for now.
So this slide shows the stats regarding pharmaceuticals, which I say is a numbers problem, considering how high they are. There are about 2,000 active pharmaceutical ingredients available in prescription, over-the-counter, and veterinary medications. 30 to 90% of oral medications taken by humans or animals are excreted as active substances in urine and feces, which have the potential to have biological effects on wildlife and humans. Extremely high pharmaceutical concentrations have been detected in wastewater from industrial plants and recipient streams in the US and in other countries. It is estimated that about 1/3 of 4 billion prescription items become waste in the US every year. About 10% of pharmaceutical products have a potential risk to the environment. And 88% of pharmaceuticals taken by humans do not have comprehensive environmental toxicity data. This slide shows how pharmaceuticals move through the environment. The yellow boxes show the sources of pharmaceuticals that come from pharmaceutical manufacturing, livestock, aquaculture, pets, and patients. Pharmaceuticals that come from these various sources can then appear in the environment directly or from sewage treatment plants and landfills. The pharmaceuticals can then potentially end up in aquatic environments, denoted in the blue boxes, and terrestrial environments, denoted in the green boxes, which can lead to the uptake of the pharmaceuticals by wildlife and potentially affecting humans. Laboratory and field test research looking at different medications show the following. Oral contraceptives disrupted hormones in fish and frogs, which can impair reproduction and impact the sustainability of the wild fish and frog populations. Psychiatric drugs such as fluoxetine, sertraline, oxazepam, and citalopram have shown behavioral changes of fish regarding feeding and foraging behavior, which may reduce their chances for survival. Antifungals such as clotrimoxazole, which can be found in over-the-counter products, can reduce growth in algae and fish. This slide shows how pharmaceuticals can affect humans. Pharmaceuticals from hospital use or veterinary medicine go to landfills for disposal or undergo wastewater treatment. Regardless of attempts to dispose of pharmaceutical waste, there can be leakage into groundwater or surface water that end up being consumed by humans. Hence, any active drugs from the pharmaceutical waste can potentially have biological effects on humans. Antibiotics appear in the environment via human and animal urine and feces, which encourages the evolution and spreading of antibiotic-resistant genes. Microbials with these acquired antibiotic-resistant genes render antibiotics useless, contributing to the global public health crisis of antibiotic resistance. The effects of anti-cancer drugs, such as fluorouracil, which is shown by its chemical structure on the slide, along with other cancer drugs, were studied in algae, crustaceans, and zebrafish. Crustaceans were the most heavily affected, showing growth inhibition and DNA damage. Fish exposed to fluorouracil showed changes in liver and kidney. The concern of these hazardous drugs is that the residues in the environment may, in the worst case scenario, lead to extinction of susceptible organisms. At the same time, theoretically, humans exposed to these residues may experience increased cancer incidence and reproductive defects. The biotech and pharmaceutical industry is a major contributor to global climate change since it's among the world's largest carbon emitters. According to the World Health Organization, climate change is among the greatest health risks of the 21st century and has the potential to change infectious disease patterns. For example, increased warming leads to increased mosquito population growth and survival, leading to increased transmission of the West Nile virus. Warming of water bodies also allows the growth of Vibrio species like Vibrio cholera, leading to outbreaks in areas where Vibriosis is rare.
So we're going to navigate into breakout rooms now to brainstorm some ideas for what you can do in your life and in your profession to keep drugs out of the environment so that they don't have a deleterious effect on humans and wildlife. So you're going to be randomly sorted, and once in your breakout rooms, please turn your cameras on and introduce yourself briefly to your group. There will be a facilitator in each group to work with you. We look forward to gathering back together after the breakout rooms.
I know I was surprised to learn that shampoo was something I should be paying attention to. I'm very diligent about the medications, but I never thought about other things that were polluting and hurting animals, humans, and the environment. But how about other folks? What did people learn in their rooms? What are their thoughts about what you can do as an individual and And also as a collective, as a society, what kind of questions should we be asking? What kind of advocacy should we be doing?
Our group talked about from a healthcare perspective, making sure that our clients or patients are properly educated when we know what meds they are taking. Some are newer to the clinical area or haven't had a lot of exposure in that, but also having the awareness of, that oversight to make sure, that they have the information and that they're doing that properly. There was concern, and rightfully so, about personal safety of having, like biohazard spills and things like that to consider. And we also talked about, from the ground level, just the products that we use at home, over the counter, all of those things and having an awareness of what that list is of meds and things that can negatively impact.
That's great. Thank you, Donna. How about another room? I've got room 10's feedback. I'll read that really quickly as someone gets brave to share. So room 10 said providers should educate their patients where, capitalized, to dispose meds. Understanding environmental consequences, patients can help friends and family be accountable to. Asking for smaller prescription dosages if possible and needed. I think that's a really great suggestion. And then we have from Christopher Shakespeare, things we can do. Excess drugs taken to police department, DEA take back days at trash to energy at various states, limiting the amount of medication. So there's kind of a theme here of that sort of points to a collaboration between prescribers and pharmacy in some ways, and obviously patients. Other thoughts? Anyone else want to share what went on in your room?
I will say, and Christopher, thank you for scribing for us. One of the issues that we had a quick mention about was taking it back to medical providers, and that's a very touchy situation. If it's a controlled substance, it cannot go back to your medical provider. If it's a non-control, again, the recommendation was to destroy it yourself in a kiosk.
I got a medication recently. I asked them to give it to me in small amounts just in case I couldn't take it because of allergies. And they said it needed to stay in its original packaging. And it was not a controlled substance in the least. So it seems like rethinking some of this stuff is really important. I think another comment that was made is make it more patient friendly to dispose of pharmaceuticals. And I want to emphasize this one. There's room for advocacy within hospital systems so that you're not opening multi-dose containers. Oh, just what I just said. But also advocacy on a policy level. And actually for all of us as health providers or public health or other programs to advocate as professionals to change the policies that are there. I'm looking at you, Ken. I'm going to say yes. All right. I think we're ready to move on. Thank you, everybody.
Okay, very good. Thank you. So the next few slides, I'm going to be the first one. I'm talking about different methods of how to keep the drugs, pharmaceuticals out of the environment. And the first topic is reverse distribution. And this is a method that's usually used in hospitals and pharmacies. And it involves moving unsold saleable inventory within or removing the unsaleable inventory from the pharmaceutical supply chain. It's a complex system. You have to be it's done by a third party reverse distribution vendor that are licensed and registered. It is safe and secure, and it involves the supply chain stakeholders to manage the products. And I must say that once, if the manufacturer is unable to reuse or resell the product, then the reverse distributor has to manage any product that's left over as hazardous waste if it falls under that category. You can't just ignore it and pretend that it doesn't exist. So there's not a lot of options, but there are some that we can do. the proper disposal is really essential. It's the responsibility of all the waste generators, whether it's a hospital, a pharmacy, I guess us as end users of a drug, we're a waste generator, but we're just not regulated like a business might be to some degree, or at least the same level. There's a limit to the number of options available for disposal and destruction. Jed is going to talk about what large scale, what the public can do. I'm looking at more what businesses can do at this point. So there's municipal solid waste landfill. The only problem with that is that most of these are not permitted, and they're not set up to accept items that are hazardous. If they end up there accidentally, or people throw out their drugs, it's going to end up into the groundwater, creating problems. So that's not really an option. Regulated medical waste is another option. You have to use a vendor to manage regulated medical waste, and it's typically infectious waste and sharps. There can be trace amounts of chemotherapy that's accepted, but it's very limited. And these facilities and vendors don't normally accept non-hazardous waste, so that kind of limits what a business can do. And then the third, we would use hazardous waste incinerator at a facility that's permitted to handle anything under the RCRA hazardous waste regulations. These facilities, however, can't accept bulk chemotherapy, and they also typically do not accept regulated medical waste. So it's very specific. What's important is at the generation point for the waste generator, that they segregate their waste accordingly to try to minimize what's going to each of these facilities, and also trying to minimize something that's contaminated with a hazardous waste. We don't want to end up with it at a landfill or at a regulated medical waste facility. I think that's all I have.
Thank you, Ronnie. I'm going to talk a little bit about our efforts to get rid of this stuff. It's the DEA National Take Back Initiative. Next slide, please. No financial disclosure. National Drug Take Back came out of a couple of impetuses. The first one was because the Controlled Substances Act does not specify it, at least it didn't originally, about how to get rid of controlled substances. It was never thought about. And then later on in 2010, they actually passed a new act, the Secure and Responsible Drug Disposal Act, to specifically handle disposal of these drugs by specific types of registrants, DEA registrants. And in the same year, we were tasked with coming up with the regulations on how to make this all happen. Another, not in an act, but trend that we were seeing, there were a series of national studies showing that unwanted and unneeded medications being stored in medicine cabinets, closets, under the sink were proving to be an easy source of supply for people who had substance use disorders. Teenagers, relatives, what have you. It was common to steal those drugs and abuse them. So the basics of our take back, it's national in scope. These are only for citizens, okay? So for everybody who's going into a health profession, if you're working at, for example, a dental practice and you want to destroy all of the expired vials of midazolam, you cannot walk it down to a drug take-back event and drop it in the bin. You have very specific legal requirements, some of which Ronnie touched on, for documentation, record keeping, and methods of destruction. Okay, we do it twice a year, April and October, on the last Saturday of the month. You just come up, we don't ask any questions, you just drop it in the box. Last few years, we started accepting vapes and e-cigs as long as the batteries are out. And at every site, it's legally required. We do have law enforcement present for security purposes. And then the agencies, the law enforcement agencies, are also designated collectors, which is why you have nowadays a lot of kiosks in police department lobbies. It's a short event, 10 to 2. And then once everything's collected, we box it up, weigh it, document it in terms of weights and numbers that we've collected. And then we, as law enforcement, take it to a secure destruction site. Here in Portland, we use Echo Maine, and we supervise the destruction to make sure everything is disposed of properly. To promote it, no surprise, we do social media. We do advertising, both online and offline. There's media outreach. There are in some communities, they make it into a community event. They get volunteers from different organizations to host a drug take back. We see all kinds of ways to promote it. We also have on our website zip code search tools to find a take back site, as well as a permanent collection site where you can go every day. And just wanted to show a couple of stats. So last October, we collected about 300 tons across the country. You will see, though, that Maine, we were at 0. That's because we ended up canceling the take back event at the last minute due to the tragedy in Lewiston. Law enforcement was rightly focused on addressing that situation. And so we felt it was inappropriate to distract from a very serious situation. So we simply canceled. We'll be back again in April 27th to collect. And we've had 25 of these events. And just to show you, we've collected about 9,000 tons across the country of unneeded and unwanted drugs. And I just called out the New England totals. You can see here in Maine, done a nice job over the years, picking up about 500,000 pounds. But we are seeing an interesting trend. So as more and more pharmacies, hospitals, police departments are installing kiosks year round, we're seeing the event numbers start to drop. The total pounds collected are trending downward, which is why we are changing our message. Next slide. To every day is take back day. Okay. So per the Code of Federal Regulations, manufacturers, distributors, reverse distributors, narcotic treatment programs, hospitals, clinics, pharmacies can become designated authorized collectors. They simply have to contact us and we change their DEA registration. They have certain rules and regs they have to follow to do it as a collector, but they can now become a year-round site where people can simply walk in and drop their unwanted drugs in the kiosk. And they never have to wait for a drug take-back event. So the message is now every day is drug take-back day. When you, as I say, get out in the professional world, you're going to want to know these rules and regs. You can find them on our DEA diversion website. They are contained in our practitioner's manual and our pharmacist manual for, again, anybody who's either going to be a practitioner or a pharmacist. These are great tools. You can download these books. They're PDFs, and they'll actually give you plain English rules and regs for all types of issues about the handling of controlled substances. We, of course, have a disposal page with rules and regulation information. We have guidance documents, the answering Q&As, and always, 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 you can feel free to call your local DEA office. We just because you call us doesn't mean we're going to come investigate you. We're not going to slap cuffs on you. We're not bogeymen. We are more than happy to solve a problem with you before it escalates into a bigger problem. I thought I'd also bring everyone's attention to illegal drugs and their impact. Our DEA museum, which is open to the public if you're ever in the Washington area, did an entire exhibit and lengthy video on the impact of illegal drug production on the environment. And I can tell you it's horrendous what is happening in the rainforests and other locations. Huge amounts of hazardous materials are being dumped every day. And in fact, we have hazardous material teams that will go in and try to neutralize some of these sites when they're dismantled. And it is highly, highly dangerous work. But here's my contact info. If anybody wants to reach out and ask questions. I'll also point out for soon-to-be graduates, we're hiring. If anybody wants to be a special agent or diversion investigator, which is what I am, I'm happy to talk about that and send you over to usajobs.gov to sign up. And that's it. Thank you.
Okay, so this slide shows the different ways that your patients and you can help the environment, which were already discussed in your groups. Behavioral changes. Prescribers over-prescribe. And patients consume over-the-counter medications when they self-prescribe. So prescribers should only prescribe medications when needed, and patients should be counseled to not self-medicate with over-the-counter drugs. All members of a collaborative healthcare team can counsel patients to reinforce this point to help lessen the production of pharmaceutical waste. Proper disposal. The best way to get rid of leftover prescription drugs or unused prescription drugs is to drop them off at one of the many drug take-back locations in Maine. Companies like doTERRA provide at-home drug destruction that can then be disposed of in normal trash. The company Stericycle offers MedDrop kiosks across the US and seal and send envelopes to dispose of household medications. Federal guidelines used to recommend flushing unused medications, but it is now not recommended due to its harmful impact to wildlife and public health. However, if drug take-back programs are not available in your community, the FDA flush list includes medications that should be flushed because these medications could cause serious harm, including death, if accidentally ingested. Medications not on the FDA flush list can be disposed of in the trash with specific instructions from the FDA on how to do so. Policy changes. Your patient and you can also advocate for more education and research. By improving the knowledge and reporting of pharmaceutical residues in water, their ecological impact, and human health risks, groundwork can be laid for future programs on pollution reduction. The US government can pass regulations requiring mandatory environmental toxicity data before approval of new medications and provide incentives for pharmaceutical companies to invest in sustainable green pharmaceuticals, which would require those companies to reduce their carbon footprint. Governmental or company investments in newer technologies that will remove or inactivate pharmaceuticals can help prevent pharmaceutical residues in the environment and risk to human health. And improve disease prevention by increasing access to safe water supplies, sanitation and hygiene, and improving precision medicine can help with effective diagnoses. These will help reduce unnecessary use of pharmaceuticals. Now, this list is not complete. There is so much more that you and your patients can do. You just have to get involved.
Wonderful. Thank you very much to our presenters. At this time, we're going to encourage questions and comments from all of you in the audience. And there have been some really wonderful ones already listed in the chat. And I just want to draw the presenters' attention to those. There was one about the role of insurance companies. Is there a role for insurance companies to play in preventing unused medications ending up in the environment?
Well, that's an interesting question, because in Switzerland, what they've done is that they provided information regarding the environmental toxicity data along with the drug that is actually comparable to other drugs. So insurers could say, you know, we will insure this drug because it has some good, you know, environmental data compared to other drugs that don't necessarily have that.
There was a question in the chat also. I think this one would be for Jed about do you think having police and law enforcement at these sites might create an environment that is harder for some folks that might come forward with an accumulation of drugs?
No, we keep it very low key. Really they're there more because number one, the regs require it. But it's usually the community service officers They don't even look at what gets thrown in to the box. They, frankly, most of them will pick up the box, bring it over to your car, or, you know, sometimes in some cities they pass out literature, or do other types of safety things. So I can understand the intent of the question, but it really doesn't tend to play out that way. Also, somebody asked, they said that Portland was not showing up in our locator tool. I will be going back to check that. It could be a glitch, and I will make sure that happens. Somebody also, I'm sorry to interrupt, about passing a law that makes it the responsibility of the companies. That's actually is a law. Maine has that law. And what has happened is the manufacturers have a private company, have pooled their resources to hire a private company to install kiosks around the state and handle drug disposal.
I want to thank all of our wonderful audience members for these insightful questions and the comments that have been shared, and to thank you again to our breakout moderators for facilitating thoughtful and engaging discussions. For the sake of time, I'm going to wrap up today's event, and I just want to thank again our three amazing panelists for sharing their inspiration and their expertise. We are very grateful that you took the time to speak with us today. And audience members, if you have any more questions or thoughts to share, please contact our panelists directly. They'd love to hear from you. Many thanks again to our amazing partners, the UNE Planetary Health Council and the Center to Advance Interprofessional Education and Practice and UNE Communications team. Without all of you, these events would not be possible. And a big thanks to all of the audience for joining us. Planetary Health truly is transdisciplinary. It's only when we unite across disciplines to discuss and grapple with these critical issues together that we're going to have the greatest potential for solving them. And I want to draw your attention to the QR code that's on this last slide. Everyone in the audience, before you leave today, please fill out this brief attendance survey that's shown on the screen. And Michelle has also been posting it in the Zoom chat. We deeply value your feedback, and we want to use your feedback to inform our future events. And also, as a reminder to our students, today's event addressed interprofessional competencies of communication and values and ethics, and it can be applied toward your students' interprofessional honors distinction. And I'd like to hand the floor over to Shelley Cohen-Conrad, the director of CAPE, to share some information about CAPE's next big event.
Yeah, well, before I do that, Alethea and panelists, bravo, that was fantastic. And I know that everyone who participated got an awful lot out of it. Our next event is March 20th, Wednesday, March 20th. And this is going to be a really provocative and fascinating discussion on navigating cultural and disability biases in healthcare. And it's going to focus on building trust and bridging gaps for new Mainers. So I hope many of you will put that on your calendar and will be interested and come to attend that event. I'm sure it's going to be as scintillating as this event was today. Your future patients are going to come from a variety of cultures and backgrounds and races and genders and experiences. And so specifically in the world of disability, we really want you to think about how you handle your cultural humility and your awareness in dealing with patients, clients, family members, and caregivers. So this is presented in collaboration with the Maine Leadership Education in Neurodevelopmental and Related Disabilities, or LEND. And we hope to see you all there. And thank you all. And thanks to our crew, Chris Hall, Michelle Cody, Lee Cody, and Dave Dadiego for today. And we hope to see you again soon. Thanks so much, and have a great rest of your day.